How's it going, guys? We have a medium difficulty question for Heme Gastro Step 1 Internal Medicine 2CK. 9-year-old boy, 2-day history of yellow eyes, sclerolicterus. Recently recovered from an upper respiratory tract viral infection. He did not receive any medications. Hemoglobin low, 10 grams per deciliter. Should be 13 to 17.5 in males, non-menstruating women, 12 to 17.5 menstruating women. Total bilirubin elevated at 2 milligrams per deciliter. Should be under 1.2 technically. You'll see it around 1 generally as normal. And in terms of the direct fraction, it should be 0.1, okay? Which I didn't give you here. Doesn't fucking matter for this question. Point is, we have sclerolicterus and bilirubin's clearly elevated. And then we have a direct antiglobulin test, very nebulous sounding, which is just another way of writing a Coombs test. And all that means is that we have antibodies against RBCs. That's all it means. And then we've got blood smear showing spherocytes, and which the following most likely explanation for the findings. Choice A, abnormality of cytoskeletal ankyrin, wrong fucking answer. Now, literally just made a clip yesterday where I had hereditary spherocytosis as the answer. Now, this is where students are like, OMG, erratum. It's not fucking erratum, okay? Now, this is what you need to know. Spherocytes are not only seen in hereditary spherocytosis. They are also seen in choice B, autoimmune hemolysis, correct answer. So this is what's going to go down. If you know hereditary spherocytosis is a heterozygous, because it's AD, if you know that it's a heterozygous mutation, ankyrin, spectrin, band proteins, you'll know that, well, that's a cytoskeleton or cell membrane defect. That has nothing to do with antibodies. So you'd have a negative Coombs test. It's not hard once we discuss it, but why would your antibodies be positive in hereditary spherocytosis? They wouldn't be. But holy shit, you can get spherocytes not just in hereditary spherocytosis, but also in drug or infection-induced hemolysis, idiopathic, okay? So we didn't have to say an upper respiratory tract viral infection, could have said a drug was given, which can make it sound like G6PD. Okay, but in G6PD, choice E, wrong fucking answer, you're not going to get spherocytes. Okay, so you get bite cells, aka degmocytes, Heinz bodies, oxidized/denatured hemoglobin. We don't get spherocytes in G6PD deficiency. Okay, it's an oxidative process that's causing the hemolysis. It's not antibody mediated. So your take home for the moment is spherocytes plus a positive Coombs test, autoimmune hemolysis, not hereditary spherocytosis, spherocytes plus a negative Coombs test or no mention of it, presumably just ankyrin, spectrin, band protein issue. So let's just hop to the others real quick. Benign deficiency of conjugation enzyme, wrong fucking answer, could refer to Gilbert, spelled Gilbert syndrome. Okay, so that's classically teenager to adult who's going to have sclerolicterus. It can be idiopathic or in response to a stressor. Okay, they like to give, your 22-year-old med student studying for exams, holy shit, they're stressed out and they get sclerolicterus. They've had a few episodes of it in the past, don't have to treat it. I've also seen it on a 2CK form for a patient who was 1 week out of an appendectomy. Okay, and obviously you want to think about other differentials if the patient's had surgery, but that's a stressor. Surgery is a stressor. Surgery is trauma. Okay, so, but that was Gilbert, that question I'm thinking of, and you'll have an elevated bilirubin where it's all indirect, okay? Choice C, wrong fucking answer. Choice D, diminution of hepatic bilirubin export, wrong fucking answer. So nebulous, recondite sounding answer choice here. So decreased bilirubin export could be obscure conditions like Dubin-Johnson, Rotor syndrome, non-existent on USMLE. Dubin-Johnson shows up once on a new 2CK NBME actually, which surprised me because it's non-existent. Students that get hysterical about these types of diagnoses. So also the fact a student will have no idea about basic gastro information but they'll know the difference between Dubin-Johnson and Rotor where they're like, OMG, Dubin-Johnson has a black liver, Rotor doesn't. Doesn't fucking matter, okay? Choice D, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.